Everybody can see it and hear it?
Yeah, I can hear you. I can see.
Right. Fantastic. Okay. I cannot see anybody who's writing any comments.
See,
because I've got it as a full screen on mine.
Right. I am going to keep an eye on the comments for you, so I'll just butt in when I can, if there are any. So I'll handle that for you.
All right. So hello everybody. My name's Bradley Whale. I'm a equine osteopath. And some of you may know or not know, I've also invented a two-part saddle. I'm not here to talk about the two-part saddle. I'm here to talk about the compensation patterns and various elements between horses and riders and the common musculoskeletal complaints you get to see and deal with. The reason why I can talk about this is because I wrote the book on equine biomechanical compensation patterns many years ago. I have also just finished writing a new theory on equine spinal mechanics, which is I'm going to start talking about, not today, I'm going to start talking about later on in the year, which would be quite nice and quite clever, and hopefully improve the industry a little bit. And on another level is that I've also worked as an elite athlete, or kind of competed as an elite athlete, so I kind of know what's going on in terms of compensation patterns and what to look out for, what not to look out for myself. So yeah, as well as many other things in my life, but that's kind of by the by. So what we're going to do is we are going to do a lovely 2-hour lecture, although knowing me, it ends up going on for a lot longer. I do have a habit of waffling on, because we're touching a subject which is very dear to my heart. I absolutely love this subject. It's full of nuances and kind of lovely details, but it is massive, and trying to kind of encompass such a complex relationship between a horse and rider in 2 hours is unbelievably difficult. And I can, as everyone can probably detest, I can waffle on for hours about it, just in one small section. So if you get me talking about the pelvises or hips or ankles or anything like that, that's me gone for the next kind of hour. So I warn you of that. So you may need to pull me up a little bit. But what we're going to do is we're going to try and briefly hit and skip along, just like a stone skipping across water. We're just going to lightly touch a couple of subjects, just so that we can all have a lovely conversation. If you want me to go deeper into certain things, I'm more than happy to do that. So yes, so these are what we're going to touch today, which is basically the saddle fit for the horse, saddle fit for the rider, common musculoskeletal problems for horses, common musculoskeletal problems for riders, and exercises which you can do or suggest to horses and riders, because obviously you're looking at the relationship. So first things first. Oh, go on.
Sorry, could I ask you a question? There's a question come up.
Yep.
What is the title of your book, please, Bradley?
Oh God, Equine Biomechanics, The Secret to Competition Success. It was written in 2008, 2009, so it is very, very old. I really wouldn't bother kind of reading it. It's very dull and boring. It truly is. It's not interesting at all. It's when in my younger years when I kind of just waffled on for a lot of rubbish, really. But it's if you want it, I can always send over copies and whatnot, so it's never an issue. We can always kind of sort that out later.
Thank you. And just one more, because it relates to a question that somebody's asked me earlier. This week, the assignment that they've had was to place the riders in the saddles and do some evaluations. And my technique is to put the rider so that they feel their bony triangle, which is the 2 seat bones and the pubic bone. And when they find that, and they retest their stability by pushing them from each side, and they find that in that triangle, they are way more stable. So that would appear to be the neutral pelvis, but the riders don't always look like the pelvis is vertical. So maybe later on, if you're covering that, you could come back to that. I mean, does a gymnast, for example, have a neutral pelvis when they're not quite vertical? So I'm a little, I'd like to expand on that a little bit.
Right. So I'm more than happy to expand on that. That is going into very deep anatomical knowledge or anatomy of the pelvis. And the pelvis is a very complex bone on a variety of different levels, partly because the way we commonly measure the neutral pelvis is from ASIS, which is the anterior superior iliac spine, to the PSIS, which is the posterior superior iliac spine. Now, the bony bit on the end is where your dimples would be, little hard bits of bone, just kind of where your sacrum is, just go out to the sides. There's little kind of hard, bony nodules you'll feel. That is called your PSIS, or sacroiliac joints is what they're also called as well. Now, the problem is with that is that depending on the pelvic shape, and we do touch on this later, whether you have what we call an android pelvis, gynecoid pelvis, platypoid pelvis, anthropoid pelvis, there are 4 generic types, but I go into detail in terms of that, we likely touch on it. That depending on the pelvic shape, changes the angles of the neutral pelvis, or how we commonly measure the neutral pelvis. So you can be doing the triad and put the pelvis into neutral, but yet the pelvis from the lateral view and the measuring from the ASIS to the PSIS as a horizontal line suddenly looks out of kilter, and it doesn't look horizontal. So there are things like that which we also have to be aware of. So yes, but we can go into a lot more detail onto that if you so want. But that's just briefly touching that.
Thank you. We're not bored.
But that's why I say the pelvis is a hugely complex subject, because you've also got, as I say, the different pelvic shapes. You've then got all of the pelvic abnormalities which can occur, and then you've got also muscle contractions and psoases and various things like that, which we all have to deal with. So yeah, well, I'm more than happy to go into a lot more detail on that if you want.
Well, we were just introducing the pelvis as it relates to the saddle and saddle design, and just in terms of having the riders put in their own saddle. Then when we put them in what we believe to be neutral pelvis, or that bony triangle contact, what happens? And we've been looking at that. So anyway, over to you.
One of the big factors with the bony triangle is actually the position of the genitalia. That makes a massive difference, because sometimes you can put somebody into a neutral pelvis or a neutral pelvic position, but because of their genitalia, you can't actually put them in a position into that position, because they end up, in the most polite way possible, they end up kind of mashing themselves, which is quite uncomfortable for everybody, really. So nobody wants mashed bits. So yeah, that's also another area which you have to. So trying to fit a man in terms of the neutral pelvis and the triad is going to be a very different experience. Is the most polite way of describing that. Right. So just cracking on. What is saddle fitting? So as we kind of say, you've seen the lovely triangle on the right hand side. Saddle fitting is unbelievably difficult. As I've openly tell everybody, saddle fitting is not just a science; it is also an art. It is the perfect kind of amalgamation of physicality and psychology. Now, the problem with fitting a saddle is, unlike any other sport in the world, you are having to put an inanimate object between two very different physically, very different emotionally, very different mentally creatures. Now, they have very different demands, such as the demands for the horse are very different to the demands of the rider. This means that you, as a saddle fitter, your job is in some aspects ruled by science and physics, but in the other is also ruled by feel and your eye, your experience, and your kind of I don't necessarily want to say gut instinct, but there is an element of feel, something which is very much deeper than just pure mathematics and science. If we look at a sport such as cycling, that's having, say, a bike fitted to a rider. That's just the interaction of the rider with an inanimate object, the bike, and then an inanimate object, which is the road. So it becomes very, very easy. Your job is unbelievably difficult. So don't underestimate the fact that you are having to deal with three different demands, which is essentially the customer's demands, what they want. If they want a pretty saddle or they want the new best thing, you've also got to look at the welfare of the horse. Is this the right saddle for the horse? And then you've got the manufacturer and what the manufacturers are actually producing, and whether it's whether manufacturers are producing good enough products or variations of enough products. It's not just about whether they're good enough. It's are there enough options out there, and are the manufacturers justifying their products to you? So yeah, don't underestimate how difficult your job is and how complicated it can be. Now, the other difficulty you have as saddle fitting community is that which theory do you use? There are various different theories and different concepts of how to fit a saddle, and how you should fit a saddle not only to a manufacturer's specifications, but also how you fit a saddle to a horse as well. There's different arguments to the how do you fit a horse with a very curved back to a horse with a very flat back. Do you fit them the same? Do you use the same theory, or do you use a different theory? There are various individuals out there, myself included in this, I will open up my hands, that have different theories on how to fit saddles. Now, as we say, the evidence that there are so many different theories of fitting and manufacture gives an indication to the complexity which you are having to deal with. So the best answer to any question when you're fitting saddles is, it depends. I know it sounds very odd and it sounds like a cop-out, but it's being informed, it's being knowledgeable, it's having as much information in your armory as possible, so that when you go out to see an individual horse, you have as much data as possible and as much information in your back pocket to turn around and go, right, this horse, in this situation, we need to apply this. And it may be actually a combination of different theories at different times. I openly turn around and say, you do not fit a young horse the same as you would an older horse, partly because of the physiology, partly because of the history of those creatures. But as I say, we can talk about that at another time if so required. So the one thing, as I said, you've also got to understand that when you do your job well as a saddle fitter, you will not get praise. You will be unknown. You will be forgotten about. You will be unvalidated. But when it is done badly, you will get the book thrown at you. It will be painful. It will be obvious. You will be blamed. You will get cuffed. You will get thrown under the bus. You will, it's all the negatives, because everyone wants to blame an inanimate object and they don't actually want to blame themselves or anything like that. But equally, you have to understand that when you almost have to take confidence and knowledge that when you do it well, you will be unknown, you will be invalidated. And that is almost kind of like a badge of honor. And it sounds very odd, but if you do your job well, nobody's going to talk about you. Nobody's going to scream from the rooftops. They should do. I honestly believe they should do, but you won't. It's the reality of the industry is that you will kind of be put to the side and, it's not really complicated. So, you've just done your job. And it's like, no, it's actually, you've done a lot more than your job. So it's get very comfortable with the fact of kind of being sidelined quite often. That doesn't invalidate it. That doesn't make it any less important. It's just, very rarely do you hear about these saddle fitters which are held up in such high esteem. They're all missed basically, because it's not the manufacturers. You hear about Fairfax saddles. It's not really about Fairfax saddles. It's about actually the saddle fitters going out and doing it. You look at the big competitors, Charlotte. It's not the company. It's not the main brand which is doing it. It is the individual saddle fitter. It is the relationship, how that individual fitter knows that individual rider, that individual horse. So your power is in your relationships. So don't forget that, because they're very important.
A comment, sorry. Steph says, thank you from all the saddle fitters here.
That's no problem. So it's going to get me blush now. So first things, when we start looking at saddle fitting, there is no universal fit for the horse. Anybody who turns around and says, oh, this saddle fits every horse. No, it doesn't. It has the potential to fit every horse. Of course it does, but everything has the potential. Whether it actually does or is kind of down to proof of the pudding. Now, as we know, every horse is different, just like every rider is different. So there's not one methodology or one way which is going to fit everything. But that being said, there are patterns of movement, which is what we're going to be talking about today. And there are structural observations which we can, to some degree, allow some predictability. So, for example, if you've got a horse which has a slight bum wiggle, or not a lameness, but an unlevelness, partly caused by, for example, a leg length discrepancy, a structural leg length discrepancy, then you can see that pattern of movement. In which case then, because it is a structural observation, you can adapt around it. Now that becomes a prediction. Now that prediction is then increased because the next horse you see might have a slight leg length difference, but it is nowhere near as bad. For example, the first horse might have a 5 centimeter leg length difference. The second horse may have a 2 centimeter leg length difference. It's still the same problem. It's still the same leg, which is kind of structurally wrong. But that means you can then do the same thing, albeit at a reduced level or a reduced kind of range, in order to help that next horse. So as I say, every horse is unique, every relationship is unique, but there are patterns of movement which we can, to some degree, allow for some predictability. The way to look at it is they are guide rails. They are not fixed. They don't kind of hold you into position. They very much kind of like the white lines on a road. They just kind of keep you in the straight and narrow, but you've got some deviation within those boundaries. That's the polite way of kind of looking at these kind of patterns of movement and structural observations. So, first and foremost, we're going to start off with the horse. Now, anybody who knows me kind of quite well is I'm very hot on observations. If anybody sees me actually work as an osteopath, they generally get shocked that I spend a good 45 minutes to an hour observing the horse. And I mean observing it walking, trotting, in the stable, on the lunge, being ridden, being tacked up, being led from the stable to outdoors, being led from the stable to the arena. Everything is being observed. I am looking at absolutely everything. I'm looking at walking up a hill. I even go out and look at its field. The first hour for me is just pure based observations. So anything, I will look at it very much from that point of view, is you have got to spend not necessarily a long time, but your first port of call is observations. So when we are looking at horses, I am certainly looking at, are there any leg length differences? And leg length differences can be, and later on we do talk about this, leg length differences can be structural and they can be functional. So you can have a leg length difference, which means that both hoof angles are exactly the same length and same height and same angle, but yet the knees on the front leg are at different heights. That indicates then, because the feet are in theoretically the same symmetrical position, there is a leg length difference in the cannon bone or the humerus and so on and so forth, which is causing the difference. That in turn will then affect the shoulder movement and the shoulder position. But equally, if you've got hoof angles which are different heights and you have knee angles which are different, or knees which are different heights, what that is going to knock on and affect your saddle fit. But then as the horse is getting the hoof changed or corrected by the farrier, that then is going to change your saddle fitting, of which then that becomes almost a predictable ratio of, because they're changing the hoof angles, you've got to go back more regularly to keep adjusting and tweaking the saddle fit. Pretty obvious, really, isn't it? Then we also look at things like sternum deviation. Now, how you do that is that's actually a very simple thing. You can put your hands onto, squat in front of the horse's chest, and you can actually feel the sternum, and you can see if there's a slight deviation. So it's going off to the one's left or right side. Now, that is particularly important because the sternum deviation can occur because of a leg length difference, but it can equally occur because of a muscular pull, such as tight pectoralis and so on and so forth, because of an over-dominance in training. Now, what is also interesting in this is because the sternum does or can slightly deviate, because you're talking about the bony ring of the rib cage, you can also have slight deviations of the spinal column. Not kind of massively common, but you can get what we call a scoliotic curvature within the horse, and that is also reciprocated into the sternum because of the bony ring. So that is also worthwhile being aware of. Now, the other thing is also simple things. There's recently been a piece of research done by Centaur Biomechanics, which has been talking about rug rub. We've been harping on about that for years in terms of rug rub. Is the shoulder which the rug is rubbed on is an indication that the saddle or the rug is slipping off on the opposite side, because the rug is pulling over, say, to the right-hand side. The rug rub is also occurring onto the left shoulder. Now, that is another observation which you can do quite easily without any, there's no poking, there's no prodding. The other elements are wither and bum height. Now, that is going to play havoc when fitting a saddle in terms of if the bum height is higher than the wither, because that forces the rider more onto the shoulder and so on and so forth. All of these things basically prove and set you up to almost a predictive way of how to balance the saddle. I always use extremes, because if the bum height is, for example, 2 foot higher than the wither height, you put a rider on top of that, they're going to topple forward, because everybody understands extremes. So in which case, that you're going to have to lift up the front end in order to try and balance that rider a little bit in modern conventional based saddles. So all of these factors, all of these observations are going to impact you and set up the beginning of a process or a pattern to start fitting saddles and start making them more effective and move better for the rider, for the horse. Sorry. The next thing I do is after observations and looking at horses and being very nerdy and geeky, is then we start looking at movement patterns. Now, I generally then, after observing, I look at the horse, what I certainly call is pure. So that means that there's no rider on top. There is no kind of influence of the rider or hack or anything like that coming on board. I just want to see the pure movement of the horse. I want to see if there's any lameness or shortness of leg movement. I want to see if there's any kind of bum wiggle. You can always tell that with the tail swishing off to one side, but it's not always. The other thing I also oddly do is when horses are being, you do a walk away and trot back and walk away and trot back. I also stand to the side, and I generally try and watch the horse breathe. It's quite an uncommon thing by a lot of therapists or a lot of people, but I want to watch or see how that horse breathes. Now, it's particularly easy in this time of year because it's cold. So you can see the puffs of air coming out of the nostrils and various things like that. The reason why I want to see the horse breathe is I want to see how the diaphragm is working, whether the horse is doing little short, sharp breaths, or if it is kind of more a relaxed breathing, and the legs are tracking up through. Now, I'm looking at all of these in fits and stages. I'm not just looking at one and then looking at the next bit and then looking at the next bit. I'm looking at grades of all of them. So, for example, a shortness of the stride and a sudden shortness of breathing pattern kind of logs into my brain, and you suddenly go, right, okay, well, also this horse is young and it's bum high. Oh, right, okay. There's something going on here. Doesn't necessarily mean that we need to panic, but it's you're starting to create little bits of information, almost kind of like Hansel and Gretel's little kind of trail of Smarties to lead them home. You're trying to lead these little trails of Smarties in order to send you to a diagnosis, and ultimately then a plan of how to fit the saddle, and also how to evolve the saddle fitting process for the future. Now, this is just a video on how you've got a lame horse. I'm just going to do that again. So you can see there, you've got a couple of things going on there in terms of the video, also due to the environment as well, or potentially due to the environment. So that's kind of another thing which we need to consider is the environmental impact. If you're leading a horse out and it's kind of winding and rainy and horrible, that will impact what you're going to observe and what you're going to see in terms of the mechanical movement. I've seen horses that when they come out on a cold day, they're stiff as a board. They warm up, they're absolutely fine. They've had x-rays, there's no arthritis. It is just because the horses are stiff, and it is because of the muscular complaint. So then we have to treat that. We also then subsequently found out through all of that, we found out something which was physiologically wrong with the horse, which I will touch base later on, because we are talking about mechanics, but I also must talk about the physiological aspects which can affect the muscular aspects of saddle fitting, but I will come back to that later. So the problem we have when we're kind of as saddle fitters trying to go out and fit saddles, we have a chicken and egg scenario, which is observations can cause variations in movement patterns, and movement patterns can cause changes in what we observe. So what we mean by that are, if you're looking at a horse and the muscles are asymmetrical in terms of one side is built up and the other side isn't, that will cause a variation in movement pattern. Of course it will, because you have that. Now, the problem is also that movement pattern is going to exaggerate the original observation as well. So the same horse, you are in this chicken and egg. And how do we break that? Well, we're going to come back onto that later, of how to break it, or how to kind of correct that. But this is the problem which you are in, a chicken and egg scenario. What you observe that has a variation, or can cause variations in the movement, and the movement can cause changes into the observation. So we definitely need to be fully aware of both sides of the coin when we're dealing with the horse and its kind of various problems. Right. So the element of being a saddle fitter is basically knowing what can and cannot be changed. Now, this is a very complex subject which we just need to talk about. Is not only knowing what can and can't be changed biomechanically, but also knowing what you as a saddle fitter can and cannot change. It is also understanding what effects of those changes are going to be. Now, this is very, very important to really understand on a very deep core level. So we're going to go through a couple of examples here, which is what can and cannot be changed. And this is where we're talking about, okay, are you dealing with a horse which has had a structural abnormality, i.e. a leg length difference? Or are we dealing with a previous damage to the deep digital flexor? Those are things which cannot be changed. Those are things which will forever affect the movement of the horse and potentially the performance of the horse. You cannot change that as a saddle fitter. That is obvious, as you know. But what that means is you will then be dealing with those compensation patterns. Now, those compensation patterns, so it is about understanding the effects of those changes, which you will need to do to that saddle to compensate for the compensation of the injury. Now, if we are, for example, to give you a scenario which is a deep digital flexor tendon on the front right leg, that will cause muscular imbalances, that will cause shoulder rotation changes, that will cause stride length changes. All of these things, you then compensate the saddle for those changes. The horse feels better. The horse starts moving better. The horse suddenly starts being put under more pressure by the rider. Inadvertently, then, and this is not a reality check, but this is you've almost got to run the effects of those changes. You have suddenly allowed that rider to suddenly push that horse a lot harder, because sometimes people are greedy. That means that by doing the right thing on some level, you are also loading up and running a higher risk of causing re-injury. Now, it's not about kind of telling you and saying, no, you shouldn't do this or anything like that, but it is knowing the full extent of the possibility of what you do as a job and what you can do to help and improve those horses. But you are also...
Sorry, Bradley, can I just ask something or make an observation? I found that in the past when I was working with people, that you make them comfortable, so you make this big effort, and they could be crippled when you get there, and then suddenly you go for the next session, so you've made them feel so much better, and they've been gardening and they said, I've made myself just as bad. So that just
that's exactly what I mean. Now that is exactly what I mean. Is it is talking about and having this open, honest conversation with your peers, with colleagues, so on and so forth, where it is okay to sometimes not feel too comfortable about making positive changes. Everybody wants to make positive changes, but sometimes if you make a positive change in a situation, because you're dealing with a human and you are there to help the horse. You may inadvertently put the horse in a situation where they are then put under more load, more strain, and more stress. Now, I have certainly done this previously in the past. I have treated horses where I have said, look, I can get the horse back to performance, but it cannot perform at the previous level. It must perform at a lower level.
Yeah.
But the riders have then turned around and performed the horse at a higher level, and even higher from where it was previously, because the horse feels brilliant. Now, that puts me on a very perilous ethical background, because I've done the right thing. I've made the horse more comfortable, but it's somebody else which is now loading that horse and putting it into more danger, because it's of a higher risk to re-injury. So this isn't to necessarily say, you shouldn't do this, but it's understanding the full effects of what you do and the individuals which you're dealing with. Now, this is where, as I say, having that conversation with individuals and being open and honest, whether you have individuals which turn around and go, "Yep, no, just get it fixed," then it's your call. It's completely in your realm of turning around and going, "No, I will get this horse up to a point, but I can't take it any further because this person is the type of person who will push this horse and push it to breaking point." And it's your ethical kind of compass which controls that, really. So it's understanding the full effects of what the individual does, because you're there to fix the horse, but then also you're there to deal with the rider.
What I do, it's not unusual for me to say, "Yeah, you can take it competing, no problem, but stay in the collecting ring. You're not competing. You can have your day out, bring a picnic, but it's usually a young horse. So just stay in the collecting ring." So but it is a issue.
That's why I say this is, we're not just trying to talk about just the simple biomechanics and everything like that. It is also kind of, there is an ethical element to having this conversation, because if you are going into horses which have mechanical complaints or problems, you have to talk about the ethics on that level. Because rehabbing or correcting or doing rehab saddle fitting is very, very difficult, because people are okay when it's broken, but as soon as it starts working, they kind of get greedy and they want more. And then you have to kind of not necessarily control that, but you have to curb it for the good of the horse. And I've certainly walked away from situations where could have been lovely, could have been lucrative, and various things like that. And I said, no, ethically, I'm not willing to put a horse in pain. I can fix it, but I know that this person is and has a reputation of pushing the horse till it breaks. So I'm not gonna do that.
And this is often why we must keep a dialogue open with the vet, because if the vet says it can compete, then yes, there's an ethical issue, and maybe the vet hasn't spent as much time with that horse as we have, but at least it kind of pushes the responsibility onto the vet, rather than for us to carry that ourselves. So it's important for us to
I'm always a big advocate for open dialogue. I openly turn around to people. I've got nothing to hide at all. So if you've got nothing to hide, everything's on an open plate. I'll quite happily talk to vets. I've had very stern conversations with some vets where I've said, look, I'm not comfortable doing this. I can quite happily do it, but I need your kind of understanding and knowledge that you want me to do this. I don't feel comfortable doing it, but if you want me to do it, I can. I've equally had conversations where I've disagreed with a vet openly. I said, no, I think your diagnosis is wrong. I categorically disagree, and these are my reasonings. The thing is when you're having these open dialogues with vets or any kind of professional, when you have disagreements or you think there is an ethical line which is being crossed, as long as you are open and you explain yourself clearly and concisely, and you put that in writing and you send it to them, and you say, look, it's all well and great having a conversation, on the telephone and everything like that, but as long as you put it into writing and you send it over to them, you are protected in any way, shape, or form. Even if it all goes Pete Tong and terribly wrong and all of that, you can sit there and not necessarily do an ego thing of turning around and going, see, I told you, little finger waggle. It's got nothing to do with that. It's turning around and going, this is also me trying to protect myself, trying to protect my customers, trying to protect everybody, really. But it's got to be in writing, and it's sending it over to them. Now, it doesn't mean that you have to kind of point your fingers and saying, I disagree with you. You can say, I disagree with you because of this, and this reasoning. And this is my logical understanding of what is going wrong. And this is what I think is going wrong. But I'm more than happy to continue with what you suggest. You know, ultimately, we all work underneath vets. But just being open and honest and explaining your logic, because you've also got to see it from the other side of the world, which is the vets. You know, the vets are unbelievably busy. They are stressed. They are not experts in biomechanics. They are not experts in saddle fitting. They do a course on it, which is a couple of hours. That's it. It's that. It is, unless they're in that realm of expertise, it is not kind of what their specialism is. Now, the other thing to also realize is you are a specialist. You know, you are a specialist within a specialism. You know, saddle fitting is a specialism. Remedial saddle fitting is even more of a specialism. Then you're talking about horse and rider fitting. That is even more of a niche. You know, so you're a niche within a niche within a niche. So it's your knowledge, your depth of knowledge, in some regards has to be better. But you also have the ability to be a generalist, because vets do not look at human biomechanics.
Yeah.
You look at human biomechanics. That you've got 50%, which they don't even look at. They look at lameness. They look at equine biomechanics. They're not looking at human biomechanics. Now, if you are sat there with a piece of paper and you go, right, I disagree with your diagnosis because the rider has X, Y, and Z, and the horse has X, Y, and Z. Now, this is my logic of the reasons what's happening. That is my proof. That is what I think is going on. The vet can look at that, and ultimately they can make their decision. But as long as you present the information, you know, you're covered.
I think what also sprang to my mind, and for practitioners in general, is that you need to remain within your insurance cover parameters. And so you've got to be very careful what you say and what you advise. And also you must work within your level of competence within that which you've been certified for. So yes, we all want to help the horse. No, we don't want them all, you know, crashed at competitions. But yeah, I think, as Bradley says, we've all got to keep the dialogue open with each other. A couple of comments and questions. Yes, it's the same ethical dilemma when rehabbing navicular horses' feet. And feet can be the trickiest area here, both with vets and farriers. And I thought of this trend for the inertial sensors and gait analysis and lameness detection, and the fact that they can't really detect bilateral lameness yet. Just wondered if you had anything to say on that in relation to saddle fitting, so we don't stray too far from checking.
So, right, this is a little bit controversial, but ultimately, you know, technology is going to infiltrate into the equestrian world. You know, it is coming. It's slow. You know, the equestrian industry is very slow in the uptake of technology. But lameness locators and various things like that, they are coming. For a lameness locator to start diagnosing bilateral lameness, it is literally just a data collection and time. You know, they will be able to do that in time. Now, the difficulty is like always, they're only as good as the data allows. They're only as good as, it's like a computer. Computers are brilliant at what they do, but they're only brilliant if you know what you're doing and you know what you're doing with it. Otherwise, you know, computers are absolutely diabolical. They're a pain in the ass. The thing is you look at a horse and you kind of go, right, okay, that horse is lame. But I've equally looked at lameness locators where they've said, right, the horse is lame, And I've sat there and I've plonked the vet in front of the legs, and I said, well, it's not lame because you've got one leg longer than the other. So you've got a false lameness. It's not lame. It doesn't have a problem. It is because of the structure. So that you have one fundamental issue there is that it can detect lameness or asymmetrical movement, but you still need the human element in order to look at the individual. And it's the same thing. You know, all of these data collection elements, they focus on the generalist approach. They do not focus on the individual. Now, as a saddle fitter, you're going to be looking more down the barrel of data being given to you in terms of lameness, locators, and all of these types of data-driven things. And this is where ultimately you need to be able to learn how to understand that data, pick it apart, and actually objectively take information from that data. You know, data is very interesting and very good, but it doesn't actually give you any insight. Data is just information. It means nothing until you can start relating it and starting to find connections and interrelationships. And it's the same thing with the lameness locators and various things like that. So.
All down to the interpretation, as always.
Oh, absolutely! It's all down to the interpretation. It's not about kind of. As I said, it's kind of like computers. You know, if computer says no, it doesn't mean you have to accept it. It's looking at the individual. As I said, you know, you look at. I've sat there with some of the prominent lameness experts who have used data and lameness locators. And you sit there and go, well, the horse has got one leg longer than the other. So your data is now pointless because it's screwed. What you've said is that horse is lame, and now it's not actually lame. It's just got an asymmetrical gait because you've got one leg bloody longer than the other.
So very quickly, I don't know if I missed it. Yeah, I don't know if I missed it or not, but how can you tell if one leg the other from the carpal joint, fetlock joint on the front, and then behind you can
do that just by it's all about observation. So one of the things I do when I look at horses is you look at the hoof angles. I am a bit of a nerd, so I measure the hoof angles on the anterior hoof angle and the lateral hoof angles on both front legs. And you can sit there and you can then look at the position of the knee heights, and you can measure from the fetlock up to the knee on both legs, and you can notice a difference. You can also sometimes observe a difference on a knee height. But that goes back to the reasons why I'm a big advocate for measuring horses and having a objective measuring process, because I truly believe that you need objective measuring processes in order to then make and manufacture and fit products. Otherwise, it's all just glorified guesswork. So, But yeah. Any other questions?
Not so far. No, I think we've done the questions.
Yeah. Okay.
Ready to move on?
Yeah. Right. So, saddle fit for the rider. Now, where with the horse, we're talking about fitting a saddle is much more about mechanics in some regards. With fitting a saddle to a rider, there is an element of psychology involved in this. So now when you're talking about the rider, you're talking about the rider's wants and desires. You're talking about their emotional state, if they're nervous, if they're particularly gung-ho. We're not just looking at mechanics, you know, are they balanced? Are they symmetrical? All of that type of stuff. You can go to a situation where a rider is perfectly balanced, perfectly symmetrical, but they are nervous, in which case they need a saddle which theoretically makes them feel more secure. And it might be that they're just very nervous people. They have a horse which is placid and relaxed and everything like that, but they just have a nervous disposition, and that's not a problem. But they may end up needing a saddle which gives them more support and more comfort. Now, as we said, riders, much the same like horses, come in various shapes and sizes. But how do you fit a saddle to a rider? How is that process done? That is very, very complicated. So what I mean by this is, to understand how you fit a saddle to a rider, you also need to understand the various pathologies which can occur with riders, such as disc injuries, hip issues, knee issues, ankle issues. If there's any kind of scarring or kind of abdominal issue, all of these factors ultimately affect how the rider sits. If God forbid, if any of you have ever suffered with a back issue, and like a damage to a disc or anything like that, sitting down is very, very uncomfortable. That is, if you've got an old historical disc injury, sitting in a saddle can be really uncomfortable. It can equally also help quite a lot because of the gentle rocking movement. But that's where comfort and making sure that you are balanced and you're not put into a position where the muscles are over engaged is really important. Equally, if you've ever had a hip issue, i.e. arthritis in the hip or any kind of hip groin strain or anything like that, trying to stretch your legs over a horse's rib cage and sit akimbo on a horse can be quite uncomfortable. So all of these factors. So when it comes to fitting to the rider, don't underestimate how important pathologies are, and specific pathologies. Now, I'm more than happy to sit down and talk about specific pathologies in terms of, hip arthritis, knee arthritis, disc injuries, so on and so forth. They're always quite good fun. Pathology is a very fascinating subject in itself. But the core of what you're dealing with in terms of riders can be very pathology orientated, which is why when you take a case history, understanding if the rider has any issue is vitally important when trying to fit that saddle, not only to the horse but also to the rider. So yeah. Now, this is a subject which is hotly talked about in circles of saddle fitting, which is the fitting to the rider, the male and the female, and pelvises. So there is a sub slide after this, which is all about pelvises, and this is where we get into a bit of fun. But as we said, there are differences between the sexes, both mechanically and physiologically. As I touched earlier, we talk about kind of the difference on the triad between the ischial bones and the pubis bone and the genitalia, and that makes a difference in terms of being a male or female. It is fitting a saddle to a rider is much more than just simple pelvic shapes, although that is a lovely big banner which everybody follows after.
Yeah, we're ready for you, Bradley.
Right, okay. Right, so as we were touching on earlier, there are differences between the sexes, both mechanically and physiologically, as we mentioned about kind of genitalia and pelvic shapes and so on and so forth. But the saddle fitting for the rider is not about just pelvic shape. It's also about femur angles, gluteal musculature, flexibility, psychology, physiology, confidence, emotions, all of these things. So you're having to deal with all of that. But the primary thing you must know and understand, which you will likely do, is that the rider sits on top of the horse. Therefore, the horse reacts to the rider sat on top. Think about it like this. If you have a child sat on your shoulders, if the child is leaning over to one side, you will mechanically compensate for that child on your shoulders. That is exactly the same principle what happens with the horse and the rider. If the rider is wonky on top, the horse will mechanically compensate. Now, there is a caveat to that, which is that is on the assumption that the person, or if you're having the child on top of your shoulders, that the person yourself doesn't have any structural or physiological issues to start with. For example, if I had a child on top of my shoulders and I had a leg length difference, that then changes the starting position for the child to be on my shoulders. Now, that is the same principle with the horses. If the horse is asymmetrically unlevel, and I'm just talking about the structure, not the musculature yet, because musculature can change, musculature can evolve. I'm talking about structure. I'm talking about angles and bone length. Now, if those are asymmetrical, then you will have a rider sat on top of a horse, which can equally be symmetrical, but then the rider is going to compensate for the horse. So this is where it goes right back to the beginning, where we're talking about observation, observation, observation. You must observe, because whatever you see is going to impact the fit and the performance of the saddle and the rider later down the line, because it is basically one stacked on top of the other. Now, if the foundation is incorrect, so a good analogy is a horse, rider, and saddle is a house. If the foundations of the house are wonky, you can correct the rest of the house for the wonky foundations, but you will always have one wall higher than the other or shorter than the other, and so on and so forth. You're always going to have wonky rooms. Now, that's not a problem, but you've got to understand that, because if you're willing to put up with that, or if you're willing to adapt to products which can do that, that's fine. So it's a good analogy is a house, because if the foundations, which represents the horse, is symmetrical, then the saddle, which is the main body of the house, the rooms, and so on and so forth, are symmetrical. It means then putting the roof on, which is the rider, on top is easy. But if the foundations are wonky, then you can correct the roof and make it symmetrical and even up top. But the problem is you then have to adjust the tree or the saddle, which is the main body of the house, in the middle. So some rooms are going to have to be shorter, some rooms are going to have to be taller at certain ends, and all of these types of things. So it's very important to understand that the rider on top, although very important, is one of the last things, although everybody likes to think that the rider is so important in some regards. So here we're going to talk about pelvic shapes, which is lovely and complicated, or it can be, but we're going to try and easily glide through it relatively easy without, and if there's any questions, just throw them up, that's never a problem. So, as we kind of mentioned, there are 4 pelvic shapes: anthropoid, android, platypoid, and gynecoid. And they are all slightly different in terms of their shape, their position, and their angles. But one thing which everybody must understand is that very few people are one group. You're not. It's a sliding scale. So that what happens is you may be, as I kind of said there, 90% android with a 10% anthropoid shaped pelvis. Or you could be 50% platypoid, 30% gynecoid, 10% android and 10% anthropoid. This is because of your genetic history and your genetic lineage. Those genetics are going to influence and change the shape of your pelvis. Now, the one thing which kind of most people do forget about in terms of pelvic shapes, which coincides with pelvic shapes, is lumbar spine positioning. So lumbar spine positioning is another extension of the pelvic shape. The reason why we say is because the lumbar spine, you have a lordotic curvature. What we mean by that is that the curves forwards or anterior towards the belly button. Now, if you have an exaggerated curvature, which can happen, you will see that curvature more often in a platypoid pelvis. Now, that will then change the angle of the pelvis. Now, there are situations where, because of lumbar damage or lumbar curvature, if you have an accentuated lumbar curve, you will never get that pelvis into pelvic neutral, because they've got such an acute angle in their pelvis that trying to put them into neutral will actually cause them more discomfort. So this is where, as a fitter, sometimes you have to kind of go, right, do I fit to the rigid guidelines of I must have this athlete or this rider in a neutral pelvis, or do I actually go, this person is functional, so it doesn't matter if their pelvis is anteriorly rotated by 5 degrees or 10 degrees, because they're not in pain, they're comfortable, and they're still able to move. Now, that is ultimately your decision, which you have to make day by day when you're doing the job. That's not necessarily for an individual, a company, or an industry to necessarily turn around to. We have, an industry should turn around and go, that is your aspiration to get a pelvic neutral, but it doesn't mean you have to do it, because sometimes it will cause pain and discomfort. So, yes, that is about the other thing which we're starting to talk, or people are starting to talk about, is the inherent pressure points which occur with the different shapes of the pelvises. Anthropoid pelvis compared to a platypoid pelvis, gynecoid compared to android. They load their distribution of force differently. Now, this makes saddle fitting even more complicated, because with a pelvis like a platypoid, which has a very wide ischial tuberosities, your loading points, your ischial tuberosities, so your seat bones, are very wide apart, and they're generally quite big, and they're loading straight down. Now, that pelvis, because it's quite a wide, flat pelvis, will rotate anteriorly, which means that they're also more likely to load up the pubis bone. Now, if they're more likely to load up their pubis bone, this in turn means their lumbar curve is exaggerated. So your loading mechanism now is more onto the pubis than necessarily the seat bones. Now, if you try and rotate that pelvis backwards, you're going to then overload the seat bones, lighten the front of the pelvis, but you may have a curvature in the back which doesn't allow that. So all of a sudden, you're trying to get the platypoid pelvis to a neutral position, and you just can't do it. And this is where, as I say, the pressure distribution is really fascinating, because in that situation, you turn around and go, is it worth it? Whilst with an anthropoid or an android pelvis, which is very up and down, the pressure points are going to be higher slightly, because the seat bones are slightly smaller. So, yeah, we have every pelvic shape has pros and cons. Now, obviously, we're talking about the pelvic shape in relation to lumbar curvature. We also have to talk about it in terms of hip shape and hip position, because it's something which I don't talk about here specifically, but you talk about the angle of the neck of the femur. Now, different pelvic shapes typically can indicate different angles of the neck of the femur. There's a lot of words when you're having to kind of talk about all of this together. So you've got so again, giving you an example, a android-shaped pelvis, which is a pelvis which is very up and down, very in the most polite way possible, a very Scandinavian, very small, skiddy pelvis. You know, the people who have pelvises which are very, very small, very upright. Now, those hips which they have, their angle of the hip is also equally very upright, because they have a very upright pelvis because the angles of the socket joint is at a slightly different angle. So the problem is you're not going to get people with an android pelvis with a 90-degree bend or curve or angle in the neck of the femur. You know, they're not going to suddenly have an android pelvis and really wide hips. What they generally do is they have an android pelvis and they have a very narrow or upright angle of the head of the femur. Now that in turn changes how wide those legs can go, and it changes the articulation surface and the loading mechanisms and various other things associated with hips. Now, hips I can go on for hours and hours and hours about, and if you want, I can do that. That's quite happy because it's quite fascinating because it's all hip angles.
Before you do, I've got a couple of questions here. There's so marketing out there in saddle fitting in relation to male-female pelvis shapes. Do these 4 shapes apply to both sexes, or is one sex more prone to any of the shapes over another?
Right, so both pelvic shapes exist in male and female. They do. But they are more exaggerated. It sounds really weird. There are stereotypically more variations or more extremes of variations within the female kind of gender. So, for example, you will get men with what we call a platypoid pelvis. Those are men who, I'm going to say this in a terribly rude way, but those are the men who you look at and they are pear-shaped, for example. It means that they have a very wide-based pelvis. So pelvic shapes do exist in men, but you do not get the extremes that you do in women.
Another couple of questions. I think I've answered one, but are there any observable features that would let us know which type of pelvis a person has?
Oh, yes. It depends how closely you want to get involved with the person, because you're going to have to poke and prod places. Yes, there are ways to actually do this. It means that you require a tape measure, and you take various measurements of individuals' pelvises. Now, as I say, it depends how kind of intimate you really want to get involved with the individual. If you are a female touching another female, then generally that's okay. You know, as long as you ask permission, it's absolutely fine. If you're a male, you need to be very, very careful, because you will, if you want to feel people, and you want to take measurements, the measurements which you need to take are PS to PS, which is the posterior superior iliac spine, which is a bony points at the back of the pelvis. Then you need to take the ASIS to ASIS, which is the front of the pelvis. So you need to take the front measurement, which is just above the pubic line. It's 2 bony points, just generally where your belt or trousers would sit. It's kind of 2 little bony nodules at the front. Now, so you need to take those 2 measurements, both front and at the back. Then you need to take the distance between your ischial tuberosities, which are your seat bones. So you need to basically either take measure on one ischial tuberosity and measure across to another tuberosity and feel for it. And then what you can do is also feel for the width of the seat bones or the ischial tuberosities. Now that's where you do have to, it sounds really horrible, but you do have to palpate and feel that. You don't necessarily have to feel that. You can, taking those measurements, you can actually work it out. Now there is an easier way of taking the ischial tuberosity measurements rather than necessarily copying a feel of people's buttocks and putting tape measures against it. You can actually get them to sit in some hard, dense foam. and then get them to stand up, and then what you do is you can see the two imprints and impressions into the foam, and then what you do is you basically kind of mark those, and then you can take a measurement from that. So there is a way where you can take ischial tuberosity measurements without touching. So that is also quite good to do. Now, once you've got those measurements, it sounds really silly. You can then compare basically on different widths and lengths. So it becomes quite easy to do. Oh, and the other thing is that once you've measured the posterior PSIS, you can then measure the difference between the PSIS to ASIS. So back to front. So basically you're drawing a big giant square around the pelvis. And that's the way you do it, really.
Another question. Yeah, I think you've answered that. How do we establish via the riders what shape pelvis they have? And do the front hip points, so the ASIS, have to be an approximation to avoid measuring any belly protuberance?
They can be an approximation. There are, yes. It's very awkward. This is the problem is when you are measuring, because I was actually trying to explain, is the big problem at the moment is in the Western world is that because of our diet, we have become larger. We have put on more fat, basically. Now that confuses a lot of the shapes of pelvises, because you can have somebody who has an abundance of adipose tissue. I'm talking about it politely. Around their midriff, which does affect the perception which we can see. You know, you may look at somebody with a very large stomach and buttocks, and you go, "Oh Christ, they've got a big pelvis," and actually structurally underneath it, they're actually quite small, which is why we have to say you've got to measure from bony point to bony point. Now, you're absolutely right. If you're taking the front measurement and you have somebody with a fairly large stomach, it does make it quite difficult. Now, there are products out there where you can take a measurement without using necessarily a tape measure. So you can get, so for example, there is I butchered up a clamp, what we call a sliding clamp, which you can buy at Homebase or whatever, and basically put two extenders on it so that I don't have to touch an individual. I can ask them to put it onto a bony protuberance at the front, and then I can slide the other one up and down to put it exactly where the other bony protuberance is at the front on the ASIS, the opposite ASIS, and then I can take that measurement away and I can measure it separately. So I don't have to go near the individual, and I don't have to manhandle their pelvis and their stomach and make them feel uncomfortable. So there are ways and means if you're willing to think laterally. So you don't have to, you can get a pure movement measurement that way without having to involve the curvature of the belly.
Great, thank you very much. I mean, from my point of view, it's far simpler for the purposes of what we need. It's far simpler. We use corrugated paper and get an imprint of the seat bone, pubic bone, and I think, to me, how their pelvis is shaped, I can't do anything about that. But what I can do is get some information from the corrugated paper, and that also tells us whether they're misaligned and how they're loading their seat bones. And also, from that shape, how stable are they going to be? Is it an equidistant triangle? So, but again, as you were explaining, that the femur angle coming out from the pelvis then becomes more relevant. Now, somebody asked something. So if an android pelvis, does that give you a longer leg position, i.e. a dressage rider? Good question.
It doesn't give you a longer leg position because you still have the range of movement within the hip. if you have an android-shaped pelvis and an open, what we call an open angle in terms of the head of the neck of the femur, you can still go into a show jumping position. The problem is that the person will generally have a longer femur, it will pull your eye to having more of a dressage leg position. But it doesn't mean they still can't do the other things. It just means that because of the angle is more open, their ability to move, i.e. get into the jumping position over the fence and back up again, is reduced. Their ability to move is reduced. And that's purely because of leverage. It's not actually a problem with the joint per se. But the android-shaped pelvis does bring about other difficulties as well. Because the android-shaped pelvis, these are individuals which generally don't have a large amount of muscle mass in their gluteal region. It becomes very difficult and quite uncomfortable for those individuals if they don't have enough padding, and they can be very easily swamped by a seat which pushes them around quite a lot because there's not a lot of them. So I hope that answers your question.
Yeah, great. Thank you.
All right. Anything else so far?
No, there doesn't seem to be.
So how do we check saddle fit? This is a lovely, complex issue on a variety of different levels. Actually, how about we throw this out there to you guys? How would you, with all the information we've now given to you, how would you check a saddle?
I'll read out the answers in the comments. Yep. They will be 10 seconds behind us, so it might go quiet for a minute. Thinking time.
Yeah, that's fine.
So we've got quite a mixed group here. There are, I think, 3 professional saddle fitters, podiatrists, equine therapists. We've got a coach, riding coach or 2. So a lovely mixed group. So yeah, hopefully we'll come up with some important methods so that this either non-therapists or even therapists or non-saddle fitters can actually do a fair job of checking saddle fit. Yep. Okay, come on people, this is up to you. 3 saddle fitters. I thought I'd have 30 comments by now. Okay, somebody wants to repeat the question. Suzanne, what we're asking for is how would the group check saddle fit? What tips can you give us? What can we get from you as a group to be the most important saddle fit checks? Okay, we've got static fit, checking basic structural aspects, having checked back of horse for pressure, rubs, yes. So we start with the horse and see if anything corresponds. So any problems with the saddle panel structure, mapping that against the issues or hypertonicity, etc., any bumps, bruises on the horse's back. We can ask the rider how they feel it is. I think their muscle memory may give them the skewed feedback. We've got look at rider range of motion and movement, yeah, and the ability in the saddle, stability and ability to move, yeah, okay. And also balance in alignment with the horse's center of motion, yeah. Check where the rider places the saddle. Yes, that's something that I do. Get them to put it on the horse. They will invariably fit it behind the horse's ears. And check which girth straps they use. Yeah, so we have to check the girth. And we've got angle of point needs to match the scapular angle. Yes, so the gullet channel needs to be sufficient width to not place pressure on the base of traps and needs to have enough width to allow for axial rotation. And photos of balance stability in movement. So take a photo, yeah. Saddle panel needs to fit within the saddle support zone, ideally. Yeah, okay, so we can map the horse's back and fit the panels within that area. Then ridden assessment with existing setup if nothing looks too far off. And we've got saddle needs to be balanced front to back with the lowest part of the seat in the center of the saddle. So horizontal balance with the lowest part of the curve in the, the lowest part of the seat in the center of the saddle. Yeah. Okay, so all quite technical so far. Good. I think we've also, if we've got this picture in the middle of the rider sitting on the saddle and crushing down through the panels, we've got to make sure that the rider or the seat is an appropriate size for the rider. Yeah, and quite an important one, if there's any check you need to do, yes, the horizontal balance has to be good, static and dynamic, but just checking the pressure under the tree points, that's a huge one, and where the stirrup bars are. So definitely what's going on in the pommel area.
So one of those comments or things is they're all absolutely spot on, all of them. One of them is more important in some regards than all of the rest, and that one is where the rider places the saddle.
Yeah.
And that is absolutely, I'm really glad that, because obviously we're talking about anatomy and mechanics and everything like that, and I'm really glad that somebody brought that up, and somebody actually kind of stated that, because where it doesn't matter if you come in and you fit this perfect saddle onto the horse and everything like that, if the rider the very next day comes along and whacks it in completely the wrong position, you could have the best fitting product in the universe, but then somebody else, because they're not educated and because they don't understand, and because and that is part of your job as a saddle fitter, is to have that dialogue with your customer and have that conversation and to educate them. And education doesn't have to be boring. Education can be fun and interesting, where you sit there and you kind of go, right, okay, this is where you put the saddle and this is where I put the saddle. This is the reasons why I put the saddle here and this is the reasons why you put the saddle here. But that is a very important factor, because there's the last thing you want to do is fit this saddle, make it perfect, and then they come back the next day and they plonk their saddle into the normal place where they put the saddle, and then about 2 weeks later, the horse is bucking and rearing and creating problems, and they turn around and go, oh, you don't know a thing. Pardon my language. So then you end up getting blamed. So that little comment is really important.
Yeah.
Because what you're doing there is you are putting the responsibility onto the customer, onto the individual, and you are saying, right, okay, you tell me, you educate me about where you put your saddle, and then it's part of your job to then re-educate them again, to go, oh, right, okay, you're just putting the saddle too high up or too far back or whatever. And then then people are more willing to take on what you're doing and the changes and everything which you're providing. So all of those things, saddle structure, pressure, kind of static fit, dynamic fit, rider range of movement, all of those things, absolutely spot on. But sometimes the most basic and fundamental thing, which is giving a rider a saddle and just going, plonk that on your horse, show me where you put it. And it sounds so basic, but sometimes you do sit there and kind of go, fuck yeah, you put the saddle in all the wrong places. No wonder you've got all of these problems.
I think for me, and I check the saddle every time. I've been doing it for 20 years. Check the saddle with the horse in a physio context, and I just so often these riders put the saddle too far forward, and I say why, and they say, well, because it's going to slip back anyway. But what I'm horrified by is that no saddle fitter has ever told them where to put their lovely new saddles, it would appear. So a couple more comments here. I've had a horse lamed to the extent of needing hock injections because someone has put a fraction too far forwards and then girthed on 2 and 4, and it had sat on the shoulder for a year. It went sound when I moved it back and girthed it on 1 and 3. It's horrific how there's just the knowledge is not there. And again, that corresponds with the saddle being way too tight under the points of the tree, the panels being way too tight there. And nobody's told them to check the basic check before they get on. And I do move saddles back. So, yes, sorry, that's
the thing is no. This is the thing is, half the time your job is not, you are a biomechanical specialist. That is your job as a rider, trainer, saddle fitter, so on and so forth. You know about biomechanics. You're on a course learning about horse and rider biomechanics. So you are trying to become better at what you do. Not everybody has that desire to improve. They have the desire to be a better athlete, but they just think that's just train harder. They're not approaching it in the same level of detail. Now, you can't begrudge somebody who is ignorant if they just don't know this information.
Yeah.
You can have a go at somebody if somebody's a bit of an arrogant pain in the ass and kind of they think they know it, and you're sat there going, well, hang on, you've plonked the saddle in the wrong place here for this horse. I'm going to give you a bit of a stern telling off on this one. But that's the difficulty is your job is not only to provide a product which works for the horse, which works for the rider, but also to educate the individual to make sure that then them as a community start improving and start evolving, because ultimately that individual which you go off and sit and they put the saddle in the wrong place and you re-educate them to put it in the right place, that person is then going to tell the next person. Everybody goes to these yards and they're kind of like, oh, that saddle's a bit too far forward. Oh, I'll just kind of shuffle it back on their friend's saddle, or they're going out for a hack and they'll just go, oh, your saddle's a little bit far forward. Okay, well, my saddle fitter told me that you've got to push it further back, and so on and so forth. So that has an exponential increase within the industry and within the community. And that's ultimately what you're kind of trying to do is you're looking at equine welfare in the long term. So wholeheartedly, it is education, but it's how you pass that education over and that information to the individual.
Yeah, it is frustrating because we've got a plethora of expensive biomechanics courses. They're coming thick and fast, but these people, nobody's told them to put the saddle back a centimetre or two. So everyone assumes that the saddle's in the right place. The saddle fitter gets a telling off for a poor fitting, but often the therapist, they'll critique without checking that the saddle's in the same place that the fitter fitted it to. So yes, it works both ways.
It works both ways, but there's also a third element in all of this, which is, or third and fourth element to this, which is historically, the education of fitting saddles and various things like that was primarily taken up within the pony club and so on and so forth. And the pony club always said, you plonk a saddle on the horse's back, you push it back as far as you can, and then you stop. That's it. If you've done pony club, you always just plonk the saddle up on the wither, and then you push the saddle back, and then as soon as it stops, that's where the saddle should be. So that was the old school methodology. Now that is no longer applicable really, because we all understand how shoulder rotates further backwards and so on and so forth. Now, so you've got the old historical, pony club methodology or mentality and approach, but you also have a fourth element, which is to do with saddle manufacturing. And this isn't about bashing saddle manufacturing at all. This is just talking about it. Is people will look at horses' backs and they will go, right, there's a dip and a curve behind the horse's shoulder. And then they will look at and say, well, I know that saddle shouldn't go beyond the 18th rib. Right, okay. So what they instinctively do is they just go, well, the panel is that shape and that's where it fits into. So it's not a a massive leap to realise that sometimes people just put the saddle where they think it should be because the shape and the design of saddles or trees or panels are shaped like that. So they just go, well, surely if it's shaped like that, then that's where it has to be. So you end up having this kind of perverse kind of belief that if a panel or a tree or a saddle is shaped like that, that's the way it's shaped because it's done that for years and that's how it's supposed to be. So that's where it's, you know, it's supposed to sit right up, butted under the shoulder. And that is, you know, as I say, an inherent lack of explanation and talking and kind of opening up within the industry to educate not just saddle fitters, because saddle fitters know this, but it's the lack of responsibility to educate the community as a whole. There's a lovely lady called Kay Humphreys, who the original founder of basically the whole concept of saddle fitters, who openly turns around to anybody who fits a saddle and goes, right, shove the saddle back for another 2 inches to allow for shoulder rotation. She does that to every saddle. You know, everything is always shoved back an extra. You go to the point of the shoulder, go back another 2 inches. Right, okay, that's where the saddle should be. Again, that's a broad stroke for individuals. Doesn't mean it's right. Doesn't mean it's wrong. It's not about that. But you can easily understand if a panel or a saddle is shaped a certain way. You can easily believe that an individual who isn't educated will just go, well, it's shaped like that. That's the way it's supposed to be. Plonk it where it needs to be.
Yeah. A couple more comments. It's so difficult as it is so universal to see photos of saddles on shoulders. I find that despite writing it down at every check, it can take several times to get them to keep doing it. So consumer compliance is a challenge through every profession, not just saddle fitting.
There is a trick to doing that or getting people to suddenly realise and figure it out. It either involves you with chalk and coloured pens or pencils or sticky notes or what do you call them? Post-it notes, and sticking it on the horse's shoulder at standing, and then picking up the horse's front leg, getting the person to obviously see where the shoulder is. They put the sticky note onto the horse's shoulder, and then what they do is you pick up the front leg, and then they put the next sticky note where the shoulder posteriorly rotates to.
Mm-hmm.
And then what you do is you plonk the saddle on. And all of a sudden, they suddenly realise they've got 2 yellow sticky notes of where the shoulder stands and then where it's going back to. And all of a sudden, these people suddenly go, oh, now I understand why you keep trying to shove the saddle back and you keep telling me off the shoulder. Because a lot of these, it's about getting people to feel and get them involved.
Yes.
You know, a lot of it is creating that dialogue with the individual and going, right, cop a feel this, get involved. This is your horse. You know, you're doing stuff to benefit them and their horse. And I use a lot of visual aids. I draw on horses. I put sticky notes on horses. I do all sorts just to get people involved, to get them enthusiastic, to get them understanding why we do certain things, rather than just going, right, this is how it's supposed to be. Why? Well, because I told you so, because I have so much knowledge. It's not that. It's like, nope, come on, you want to know about this, then I'm going to help you.
Then, of course, I don't want to spend too much on this particular point, but then we start stepping on other professionals' toes potentially, because I know that a lot of saddle fitters don't appreciate us therapists coming along and saying, well, this is how you saddle fit. It's a bit of a grey area. So you have to be quite tactful and just perhaps simply say, look, the horse, if I move the saddle back or whatever, it can move better. Or if I put a saddle pad on, it can move better. So, yeah, you have to demonstrate rather than just say, you know, my 10 rules of saddle fitting says this. A couple more comments. So we've got Suzanne's giving a talk to the Pony Club about saddle fitting next
Fantastic.
week. We've loaded her up there. I think another comment. I think the problem is made worse due to modern breeding of short-backed horses, so insufficient room. That is rife, and I'm not a fan of fitting saddles or trees over the back of the saddle for various reasons. The joys of being a wide horse specialist, so many short backs and so many large riders. And we have that as a general problem. And I'm sorry to say that I see so many professionally fitted saddles that are too long if moved back to the right place. And you can allow for shoulder rotation if you fit with a wider tree and matching scapular angle. But then you need to use appropriate shimming system, so pads, as you can't just flock up the panel as it becomes a sausage, and getting them to take a photo, stood well back, not relying on a piece of mane, etc., helps a lot. That's a good one. And because many horses simply don't have enough room to put saddle that far back and not go past T18, well, then the horse and rider just are not going to be a match. So lots of
there is you're absolutely right. There's a disparity on a couple of things. Is that a lot of horses are very short backed, and we have riders which are now very long. You've got to think about the evolution of human beings. We are getting taller, which means, and that's why historically, this sounds very odd. You used to kind of go back about 20 or 30 odd years, you would have a 16-inch tree for a 16-hand horse. It sounds really old, but that's the old methodology of fitting saddles, and this is old methodology. And then if you had a 17-hand horse, you would have a 17-inch tree. That was the logic back then. That has now been obviously superseded. But you've also got to understand that the trees which are designed for riders. So a 17-inch tree is sometimes you will put a rider into a 17-inch tree, not because the horse needs a 17-inch tree, but because the rider needs a 17-inch tree because they got such long bloody legs. Now, that is not necessarily a problem with the horse. That is a problem within the industry. And as I say, this is not about bashing industries or anything like that. This is just about being open and honest and having these conversations. Now, the other thing is also, which was flagged up or talked about, was not extending beyond the 18th rib. Now, there is a little bit of controversy on that, being open and honest about this. There's a very commonly a misconception that you don't go beyond the 18th rib because in theory it causes compression or loading onto the horse's kidneys. From an anatomical point of view, that is absolutely rubbish. The kidneys are not located at T18. So if you were ever fortunate enough to see an anatomical dissection, the kidneys are not located that high up. The reasons why it is commonly not sought after to put a saddle further back than T18 is because the lumbar spine loading mechanism is not, in some horses, not strong enough. And it's to do with physics and various things like that. So if you keep putting the rider further and further back, then you overload the lumbar spine muscles, the lumbar erector spinae muscles. But also from a physics point of view, if you put the rider further and further back, you are no longer sat on the apex of the thoracic spine lifting mechanism. You are sat behind the apex, which then means that you are perpetually and eternally behind the movement. So yes, that is the reasons why it is not the commonly misthought of concept that you're going to cause compression on the kidney. If you want, it sounds very odd, but you can look up the position of the kidneys in relation to the horse's spine. They're not close to T18. They're actually closer to the pelvis in the LS junction or the lumbosacral junction. So
my experience is that if the saddle's too long and there is some compression there just past the thoracolumbar joint, that the horse, in order to stabilize there in that region, the horse develops very thickened hypertonicity of the musculature there to stabilize that junction, because it is a piece of the spine which the thoracolumbar joint has two very different vertebrae joining together. They're hugely dissimilar.
Yeah, that's the exact reason. It's not because of the commonly held belief that you're going to put compression onto the kidneys. That's the reasons why I was saying it. It's not because of that. You know, people say that because of in human anatomy, but it's not. It's completely different. You actually do it because you don't want to load up the L1 and L2 because of the position and the angle of the fat, or what we call the facet angles between T18 and L1, and it's different loading mechanics, and it's the way the lumbar erector spiny muscles then blend into the thoracolumbar fascia and the thoracolumbar muscles. So you get quite commonly an overdevelopment and hypertrophy, which creates untoward issues in other areas. So that's the reasons why. It's not because of the commonly held belief that you put pressure on the kidneys.
All myths. I'm sure that's not the only one.
Yeah.
Okay, so what we need to do, I think we've got a short film coming up next, which you can pause at different times. So we need to really get some basic saddle fit checks that we can do, so for coaches, for non-saddle fitters, so that we know when to refer to the saddle fitter, not to tell them how to do their job, but when to actually flag up a problem. So from all that information, we've got to nail down some techniques here. So off you go.
So what we're going to do is we're going to run through the video first, and then we'll go back over it.
Yeah.
So that's the run through of the video. Right, we're gonna go all the way back to the beginning. So in that video, there's quite a lot in that video.
Sorry. Sorry.
No, it's absolutely fine.
Told you I've been doing it for 20 years, so that's not even all of it.
Yeah, no, trust me, I can well believe. So yeah, there is quite a lot in that, in terms of kind of see and do, really. One of the big things is obviously where you start chalking up, which is absolutely fantastic, because that acts as a visual aid for the customer, but it also acts as a good reference point. So I'm always a big advocate of chalking up. Now, what's happening here for people who know or don't know? If you know, sorry, I'm going to kind of explain stuff which you already know. Is you're deliberately doing rotation, and you're twisting that horse's spine, and you're noting that the apex of the movement is just where you've kind of poked your fingers, generally around about T13, T14. So it's the transition area. Now, that's the reasons why you do that movement is because horses move in diagonals. No horse moves in a linear pattern of movement. It is always across a diagonal. Walk is a 4-time beat, so there's always a cross-diagonal movement pattern going on across the horse's spine. In trot, it's a 2-time beat, so there's always a cross-diagonal across the horse's spine. And then in a canter, again, cross-diagonal movement. When we say cross-diagonal, it means that there is, if you ever look at a certain breed of dog, i.e. a Labrador, you will on occasion see a Labrador which moves the front left and the back left at the same time as on the same side. That's when we talk about linear movement and you've got cross-diagonal movement. The reason why you rotate the pelvis is to allow for rotation to understand where the transition is and where the muscular tension is. So that is a definite, within the industry, you should be doing that to see what's going on there. As we say, you're marking it up, you're chalking it up, which is brilliant. Feeling for the muscle tension down the horse's back is really important. Now, the one caveat which I put onto this is you don't do it once, because that's like me putting my hands on your back and poking you in the back. You're going to react initially. Now, if I'm doing that 2 or 3 or 4 times and you react in exactly the same place, there's the muscle tension. There's a problem. If you just do it once, it could be a reaction through touch, but then that's also dependent on various factors such as weather. If you're doing that in the summer, it's very different to doing it in the winter. And what you can see here in this picture is where the saddle and the gullet, or gusset, is where the spine is as well. So you've got to make sure that there is enough lateral clearance. And when I say lateral clearance, I mean clearance on the left and the right-hand side of the spinous processes, so that you're not creating a problem. There we go. Now, yeah, this is just a lovely bit of information that you're kind of saying about the width of the spine in comparison with the gullet. It's also worthwhile in terms of the chalking, which is where what you're doing there is just over the rib angles. Again, it's worthwhile doing that within a fitting process to help with understanding how wide the panel needs to be, so that you're then not putting load mechanisms onto the horse's rib angles. Okay, so this part is now talking about the girth in relation to the saddle and how the difference is from below and above, how different they can be. Now, I'm not sure you want me to start talking about girthing structures and the mechanics and how to do that. So I don't know whether you want me to go into that, because that is a deep rabbit hole I could easily go down. So I'm not sure. I think I might leave that one. Right. So palpation of the shoulder blade. So this is where we start kind of picking up the horse's legs. So this is where I was saying about putting a post-it note onto the shoulder. This is where you've got the shoulder rotation. This is where I was talking about with the post-it notes, which is quite good to do. So measuring the shoulder, chalking it up static, and then lifting the shoulder or lifting the leg to rotate the shoulder posteriorly is also quite good as well. I'm not going to touch the jumping position. I'm going to stay far away from that one.
Well, what we'll do, we'll bring you back for the saddle fitting course. That's what we'll do.
Yeah. So far, as I say, what you're doing is absolutely spot on. You know, you've measured, you've chalked up, you've kind of given yourself the plane of areas to work within. Obviously, checking the panel angles and making sure that they're the right curvature of the horse's back, and they follow the curvature. Again, as what you're doing there, sticking 3 fingers in. Now, the 3-finger rule is quite a fascinating little rule, and it's quite fascinating in terms of the history, but it's all to do with basically padding.
Well, sorry, what I was trying to do there was get my whole hand in, but you can't do that on a close contact saddle. So to feel the whole withers right down, and I couldn't do it. So sometimes I have to ask someone with a small hand to get in there and just check that the withers are clear.
Yeah. So here you've got the different angles between the wither and the saddle panel, the saddle tree, sorry. And there is a disparity there. This is why having a flexi curve is really important, and it is your tool of authority on that one. Your flexi curve.
And they do lose their flexibility after a while, don't they?
Yes, they do. Now, the other thing which I personally quite like is the element where you put a tree on a horse's back, and you can see in that picture that tree, you've got gaping holes where it loses contact. Now, from the aspect of physics, that means that certain areas of that tree are going to be overloading rather than distributing the force across the entirety of that tree. That means that tree is going to load. There's going to be areas where there's no loading going onto that tree and then into the horse. It means that other areas are going to be overloaded.
Right.
So that is an important thing it's a personal thing I like plonking trees on. Now here, you're looking at the stirrup bars, which are bane of my life on a lot of levels. And obviously you're talking about the stirrup bars digging into the horse's back. The reason why I talk about stirrup bars as the bane of my life are to do with gullets and gullet bars, changing them wider and what we call flare. So it's flaring out the gullet bar, because everything has an equal and opposite reaction. If a gullet bar flares out, then you've got to have something's got to go in, and generally speaking, that is the stirrup bars, which then end up digging in, which you can see on this final picture. So feeling for kind of pressure points underneath the stirrup bars is really, really, really important. And the way you do that is by manhandling the tree and kind of copping a feel of the panel or the underneath of the panel where the stirrup bars are.
Fantastic. So really it's just go back to school and revise your physics. GCSE, really, most of it.
So I will openly admit I'm slightly biased in terms of physics, because I think there is a lack of physics and mathematics in fitting saddles. So please take it with a pinch of salt. I will always look at it through that lens, but I fundamentally.
Yeah, it is. Yeah. To me, it's just gravity and what everything does to fight against it, and pressures. And if this is too tight here, then it'll be way too tight with a rider on top. Okay,
Yeah.
so is there anything else? So if I was to show the group that film, a longer version of it, but what would you add to this? They've already done a bit of rider saddle fitting in their just the assignment that they've just done. What would you add to those checks that we've just seen on the film?
In terms with the horse, I wouldn't actually add a lot.
Okay.
What I would add is, it's going to sound very odd, is the assessment of the saddle. But I don't know whether you're going to be doing that.
Yeah, it's actually on the end of that film, but I kind of knew we wouldn't.
Right. Yeah. So that's where I say, this is where you would then need to assess the saddle which they're in and the tree which they're in. That's where you look at the stitching, the leather, as what you've already said before, is the wear panel, the wear on the panels.
Okay.
All of those types. You assess the symmetry of the tree, all of those types of things, because you have to.
Yeah. Well, I think what I'm going to do, I've taken screenshots of the questions because obviously, we could go on all night, but we haven't booked you for the night. So if I email you those questions, maybe you could just shoot me back some replies.
Yeah, that's no problem at all.
Great. And I think if we leave it there for now, otherwise, it could go on. Maybe there's definitely room for another session, I think. So
now, one of the things which I wanted to briefly talk about right at the beginning, which I mentioned about physiology, because all of this is focused on anatomy. Now, there's one thing which I do want to kind of flag up in all of this is do be aware of physiological problems which can impact saddle fitting. Now, this is very important. I know it's at the end, and I know you're tired and everything like that. But if you want me to talk about it further, I can. But I'm going to briefly talk about it. So, for example, horses with metabolic conditions, such as PSM or fatigue-based kind of conditions, you will fit those horses, or need to fit those horses, differently to a horse which doesn't have a metabolic / fatigue or muscular fatigue problem. The reason being is because the muscles will contract and obviously fatigue a lot quicker. Therefore, fitting those and the ranges of movement of those horses and the shoulders and the back will be different. So this goes back to your original element of observation and diagnosis and getting information. If you have a client which turns around and goes, oh, I have a horse with PSM or a metabolic condition, fitting a saddle to that horse is going to be a little bit more complicated, because you have to bear in mind that those muscles will fatigue quicker. Therefore, the compressive forces which I will require with horses and balancing the rider is going to be of a higher importance. Because if the rider's weight is being thrown around the horse, then that's going to fatigue the horse even quicker, which is then going back to various exercises to be done for riders in terms of strengthening exercises, core stability, all of that kind of palaver. But there's also exercises which you need to do for the horse as well to strengthen it up. So, yeah, that's why I just wanted to quickly say that, because I said that right at the beginning. I needed to kind of talk about it because we're talking about the anatomy quite a lot, and quite often we forget about the physiology and how that impacts the horse's anatomy.
Can I just clarify? So you're saying that the muscles fatigue quicker. Yeah. Does that mean that physically, if you're, say, looking at that horse on a treadmill, that those muscles are behaving differently morphologically, for example, than a horse with normal musculature? Is there that level of compromise with them?
Yes. They will get, so if they're on a treadmill, you video them, and you then video them for, say, 5 minutes at the beginning, and then you video them 5 minutes at the end. You will notice that all of a sudden the horses are actually moving differently. Now, that is also a benefit, but the reason being is like with fatigue-based issues, and there's multiple different kind of physiological problems with fatigue-based issues or fatigue-based conditions. One of them is to do with the mitochondria within the cellular structure and the way the actin and myosin cells kind of contract and work. So if you've got a body or a muscle which is fatiguing a lot quicker, then that will cause the muscle to then go into cramp, spasm, contracture, so on and so forth, which then you imagine you doing exercise, but then your muscles, your muscles are starting to fatigue quicker. Your body then compensates to use other muscles to keep you going.
Right.
Now, you imagine you've got a little person sat on your back who's telling you, you've got to keep going, you've got to keep going. You know, you've only done 20 minutes, half an hour, you've got to keep going. What's going to happen is you're going to get muscular compensations because of the physiology, because of the fatigue within the physiology, which is going to change your fitting of a saddle. Now, also compound that is you've got a rider which is landing on top of that horse's back. Now, as we know, when horses or when muscles are impacted, i.e. if they have an impact, i.e. you hit a muscle, the muscle will go into a microcontracture, which at a microscopic level is going to basically cause a muscle to contract. Now, if you've got a horse which is being asked to work and it's got an impact, the muscles are going to doubly fatigue, basically.
Wow, that's super interesting. I find
all of a sudden physiology becomes, in those cases, it massively impacts your fitting process. So you may end up padding a huge amount for a horse with PSM, just to try and protect.
So the way I check for that is that for me, I want to know the breed of the horse, and you know I do like to match the horse's gait with the breeding. So for me, a horse, if it's not cadent or as cadent as it was bred to be, that's a big red flag to me. That tells me there's something wrong. And then when the rider's put on and that horse does not move in the way it was bred for, then that indicates a deeper problem. But I guess in our history taking, if there are any metabolic physiological issues, then we should not be worried about calling up the vet and say, hey, can you just explain to me a bit further? I'm checking, or I'm doing my therapy or coaching. Could you just help me explain this? And I'm sure the huge majority of vets would just love to do that.
Yeah,
so
of course they will. You know, they're there to help as much as you are. You know, and you know, nobody knows everything. You know, they certainly shouldn't. Otherwise, it gets terribly boring. Otherwise, and yeah, most vets are absolutely fine. They want to have a chinwag chat and okay, right, this is what PSM is. It's X, Y, and Z. You know, this is a metabolic condition. This is what it is. You know, go and research this. Go and look it up. You know, this is a good website to research and have a look at. You know, X, Y, and Z. But this is the thing, is that don't just always think anatomy, because there's also physiology compared, or which is important into this, which will affect the anatomy. So this is why it's really important to sometimes just go right, okay, is there a physiological condition such as a metabolic condition or anything like that?
Which is getting more and more common now.
Yes.
Much more common. Okay, just another 15 seconds. There's 2 questions here. Would you advise assessing a horse with metabolic condition before and after an effort to assess their fatigue and how it changes their movement? I say yes. And then the second question, I think, which is why you need to get the riders on board. Have to, if you're therapists. And I think another question, I think shock absorption is super important for all horses, and regular panel materials don't really do the job. Amen. Especially if there isn't a lot of adipose tissues. And yeah, it's that old myth. You don't need a saddle pad or just a thin cloth if the saddle fits correctly. So yeah, we get into padding territory and what the horse and rider combination needs. So I'll ask you to round up there, Bradley, because you must be wanting to.
Yeah, don't even get me started in terms of padding material. That is a massive bone of contention within me. I will openly tell people now is that I'm working on a way of padding. I'm working on something very, 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 very clever for panels and to do with shock absorption and various things like that.
It's physics at the end of the day. It's physics.
Yes, it is, but it's also it's material science and various things like that. And I'm currently working on something very, very innovative for that, because it's one of my big bones of contention is it's not measured and calculable, and it bloody well should be. So the person who said that, they are absolutely correct. The current kind of methodology or thinking behind it is very limited. So yes.
Fantastic.
Don't ever get me started on bloody close contact saddles, even worse.
That's why I showed you this film. You've been very polite.
The close contact is it was a lovely trick. It was a trick of the industry, basically. A way of parting with a lot of more money for getting a lot less. They haven't packed up science and various things like that. So it caused me, as a therapist, more problems with close contact saddles than it was worth it. So yeah.
Wow. Well, I think we've all invited ourselves to Oxford, so to come and visit you when the COVID restrictions are off. And there's a whole saddle fitting course ready to run here. So you got the job. So
we'll just wait until what I release in terms of the equine theory. So I think that's going to kind of ruffle a couple of feathers on that one.
Equitation science is, as I read it, it's very poor, and there's even papers on it's poor. So this is all changing, and so I had a couple of thank yous in my private messages, so they're very, very appreciative, and yes, they would love to stay much longer, and they would love to know about saddle pads and all that stuff. But I'm very grateful for you for inspiring them this evening to start looking at this stuff. Just looking for themselves.
Yeah, definitely.
Well, thanks a million. A big pat on the back for you, and for God's sake, get this saddle out that you keep teasing us with.
So to answer that, at the moment, we are hopefully going to be getting it all in April. So we're looking at May, June time. Which is going to be kind of hitting everybody really, but pretty soon we're going to start coming out and actually doing our pretty version, and because the one which I threw out there ages ago, which looked ugly as sin with a too high cantle and various things like that, was essentially a way of just kind of getting
upsetting
people upsetting people in the most polite way possible, which is always good fun. But it's now we're going to be releasing a prettier version, an aesthetically pleasing version. But then hopefully May, June we start kind of really hitting it in terms of, and I'm doing research and various things like that. So I will openly admit now that I've been playing around with a sprung steel gullet bar. So we're using potentially an interchangeable gullet bar which has a degree of spring and flexibility in it, which is due to be coming out. So that reduces even more any compression over the shoulders and allows for greater shoulder rotation. We're not idle behind closed doors. We might be relatively quiet, but there's a lot of stuff which I'm trying to revolutionise behind closed doors.
And can you? Does that saddle happen to be able to fit behind the horse's ears for the riders, especially to put it on?
Yes, it does. So yeah, it can do well. That was actually one of the reasons why I designed it that way, or a certain way. Is that it allows for saddle or riders to theoretically put the saddle in the wrong place.
That's brilliant.
So there's a degree of laxity deliberately built into it. So.
Excellent. Well, you've got a page of thank yous here. Yep, great talk. Thank you, and keep waving the flag for us. Yeah, so much great information. Thank you. That was really interesting. Thank you. That was great. Thank you for a great talk and an ooh. So thanks a million, Bradley, and thank you very much for staying late. I'll get the check off straight away.
No, it's no rush. Don't worry.
And yeah, we hope to see you soon. And yeah, good luck with the launch.
Yeah, no, thank you. So, well,
thank you.
Right. Not a problem at all. Thank you very much. As I say, if you ever want more information, just give me a shout.
Yeah, I will. Thank you, Bradley. Cheers.
Take care.
Bye bye, you too.